Welcome back to Mom and Mine. I'm your host, Dr. Kat. On this episode, we have another story of a mom who experienced postpartum depression and postpartum anxiety and postpartum OCD symptoms, as well as some rage symptoms. And a lot of us who've been through this have experienced one or a combination of all of these, if not all of them, in our own journey. And specifically for us who are mental health providers, and clinicians, it's really hard when we are dealing with things on our own that we can't necessarily recognize, even as a mental health provider. I had that experience, and Rosalinda had that experience as well. Postpartum depression and anxiety can really take you by surprise, even if you know what to look out for, and especially if you're not sure what's going on. Rosalinda is sharing her story with us today. She's a licensed clinical social worker. She received her bachelor's in social work from West Texas A&M University in 2006, then master's degree from Baylor University School of Social Work in 2008. She has spent the last 12 years working as a mental health and suicide prevention social worker for the Department of Veteran Affairs. In her experience, she became aware of the lack of support for new mothers who were struggling with mental health. She created a postpartum support group for mothers in her community, and that has been running since 2017. She's also started a virtual postpartum support group within the VA for female veterans. She's here today to share her story and share her message that wanting to know that anyone who's experiencing this is not alone and it is not their fault, and that they can go through this struggle and come out stronger with the right type of support and treatment. So let's meet Rosalinda and hear her story. Welcome, Rosalinda. Thank you so much for being here.
Thanks for having me.
Always grateful for people who are coming on to share their personal experience, because it's so, even though we might be all going through something similar, there's so many factors that go into each person's story that make it unique for them. And so I think it's important to hear all aspects as much as possible. So let's go ahead and start with your story wherever you'd like to.
Okay. So, my story begins, I guess it was 7 years ago,
Mm-hmm.
a little prior to that. Um, a little background, I've been working in mental health for 12 years, and so prior to my my pregnancy with my daughter, I was working in a mental health clinic, and working with patients, dealing with depression, anxiety, PTSD, all of those things.
Mm-hmm.
Uh, but hadn't had a lot of experience with patients or anyone with postpartum depression. So I got pregnant with my daughter. Um, she was due in August of 2015. So I think late 2014 is when we found out. And I
Mm-hmm.
had really wonderful pregnancy. Really couldn't complain. I didn't have any issues with my mental health during that time, other than I think the normal worry and a little bit of
Mm-hmm.
anxiety with being a first time mom. It was my first pregnancy, first time mom.
Right.
Uh, so that went wonderful. Um, my husband has two older children. And so he's kind of been through the process before, but all of it was brand new to me.
Mm-hmm.
So once I had my daughter, um, then came the changes with the hormones and the breastfeeding and all of this. And
Mm-hmm.
it was difficult. Of course, she had colic, so
Mm-hmm.
that started around 2 weeks, and we had some breastfeeding difficulty as well. So there was already a little bit of added stress, I believe. Um, we did come to find out that she had a dairy intolerance, and
Oh,
acid reflux.
how did
So
you find that out?
she we just kept going to the doctor because of her colic. Her she would just cry and scream for hours and hours,
Mm-hmm.
and nothing could soothe her.
Mm-hmm.
When she was nursing, she was happy, but other than that, she was crying. And so, I didn't know what was normal and what wasn't with a first baby, but my
Right.
husband, I don't think that's normal.
Mm-hmm.
My two boys were screaming this much, and so he would go with me, and we'd ask. And we ended up just doing a simple stool sample from her, which
Oh,
is
okay.
it's a really easy indicator to find out for the milk protein allergies what it was.
Mm-hmm.
uh, and
Mm-hmm.
so we found that out pretty early on, so I became dairy free.
Mm-hmm.
um, for about 10 months, and that helped a little bit. We also started chiropractic care when she
Mhm.
was 6 weeks old because I've heard that that helps for digestive issues. And
Mhm.
even though colic has a name and a diagnosis, there really isn't a set of symptoms, and there's no
Right.
treatment. So
Right.
at that point, we were just trying anything we could to soothe her, to
Right.
make her happy, to, you know,
Mhm.
anything that would improve. And so we saw a little bit of improvement with that, but it still took a while. She was dairy free for 10 months, and I think her cough started going away around 4 months, and by 5 months she was pretty happy.
Oh, okay,
So
good.
that initial first, 4 months was pretty rough for all
Yeah.
of us.
Yeah. That's a
Uh,
long time when there's a baby crying a lot.
it is, and we kept telling the pediatrician, "There's something wrong. She's uncomfortable. She's crying."
Mhm.
And she would say, I promise, it's colic. If you give it time, like it should go away. It'll get better." My husband was pushing for like, let's go see the like a pediatric gastro doctor because
Mm.
something is not right. And she said, let's wait a few months. If she doesn't outgrow it, then we'll get to the specialist. We'll do more tests. We'll figure it out. But she was convinced, it's colic. It will, with time, it'll get better. If it doesn't, then we'll move on to find what else is wrong. Um, so thankfully, with the things that we did try, I mean, it was manageable. It was
Mm.
for those 4 months, but it was hard,
Yeah,
um, emotionally and mentally on all of us.
for
So I
sure.
think that was a big factor that I didn't see coming as a first time mom.
Mhm. Right.
Um, and I was able to breastfeed and nurse her for 22 months. So we got past the struggle, but initially it
Mhm.
was a struggle with the dairy issue, and even latching issues and that
Mhm.
thing. And so that was another added stress that I didn't know what to expect or what was
Right.
normal.
Right.
So getting through that as well. Um, I took 10 weeks off of work, so I was at home with her
Mhm.
for the weeks. My husband went back to work, I think, after a week and a half. So, but by week two, her colic was full set in, and it was every day, kind of
Yeah.
crying and stress. Um, so initially, I started off as just being very tearful and crying a lot. And I
Mhm.
wasn't sure what was hormones and what wasn't. She would cry and I would cry. And my husband, I think, felt just lost. He didn't know what to
Mm.
do to help either of us.
Yeah.
Um, And I just chalked it up to hormones, the postpartum period, the baby blues. I remember leaving the hospital. Labor and delivery went, really well, no complications. But I remember being the only question being asked before I left the hospital was, "Are you having any suicidal thoughts, or are you having any thoughts of wanting to harm your baby?" And that was a no. And I want to say when I um, went back, after the 6 weeks, I remember going and seeing my provider was out on a delivery. So I saw a nurse practitioner,
Mm.
and she asked how things were going. And I kind of was just like, well, it's okay, but my baby has colic. And she was like, oh my goodness, bless your heart. She said, I'm going to give you a hug. And she gave me a hug. I don't remember being asked or screened or questioned about
Mm.
any of my mental health, my emotional health, or anything. That was
Okay.
most physically checking up on me.
Mhm.
Um, but I remember just like the sense of relief or something I felt when she asked me,
Mm.
and she gave me that little hug and she left the room and I just cried and I thought,
Yeah.
gosh, this really has been hard for her to acknowledge that for me.
Yeah.
Uh, so even at 6 weeks, I still didn't realize that I was dealing with postpartum depression or
Mhm.
just a higher needs baby was stressful. And I think
Yeah.
people were acknowledging that struggle for me. But um, it wasn't really until I went back to work that I figured things, it was something more.
Mhm.
You I continued with their crying and feeling emotional, and very, um, almost like I just couldn't control my emotions very well.
Mhm.
I had a lot of worry, and I knew being a new mom, worrying is normal, but I'd never really experienced anxiety until I
Uh-huh.
had a baby.
Right.
And so it was that every time I would leave her, I would feel that anxiety, and
Mhm.
having to go back to work really triggered a lot of that, I think.
Yeah.
Uh, So I started to recognize, I'm a mess. I can't juggle this. I'm overwhelmed. And I had a really close friend who had a baby 7 weeks prior to me.
Mm.
I also had another close friend that had a baby 2 weeks prior. And
Oh, wow.
so one of them was having her baby had reflux. She was
Mm.
having a little bit of depression as well. And so I remember talking to her and telling her when I went back to work, like, I'm here in my office and I can't stop crying. I don't know
Mm.
what's wrong with me. Um, and she was the first one that suggested, maybe you should call your primary care doctor, make
Mm.
an appointment, go talk to them. Um, and so that day I did, and I got in. It was a Friday afternoon, and I remember going to go pick up my daughter, and I told my mom, I was crying, and I said, I think I have postpartum depression. And she said, well, um, but though typically those people don't develop bonds with their baby,
Those.
or they have thoughts of
Yikes.
wanting to hurt their baby.
Okay.
And and that's kind of all I had heard of postpartum depression as well.
Sure. Yeah.
You
Yeah.
you either want to hurt your baby or you don't form that bond. And for me, it was quite the opposite. I was like overly attached.
Hmm.
Um, I had that anxiety, and being away from her was just really super anxiety ridden for me and very hard.
Yeah.
Um, and and so I thought, well, maybe she's right. I don't know. But I went to the doctor that day. Um, and I ended up just doing a simple depression screening that, a
Hmm.
little piece of paper, maybe a dozen questions. And I was crying through the whole thing because I'm like, yes, 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 this is me. Um,
Hmm.
what was hard about that though is that working in mental health, being a therapist, I do those screenings with patients day in, day out. And
Right.
so I know what depression looks like for other people and anxiety, but it
Hmm.
wasn't until I saw that paper in front of my face that I realized, oh my gosh, I think I have this.
Right. Right.
Um, I didn't know. I didn't realize it in myself that I
Hmm.
had all of those checkbox symptoms. I was having
Right.
depression, having the anxiety. Later, I would come to learn with my own, researching that I had some OCD as well with
Hmm.
postpartum. Um,
Hmm.
and so that day, I got started on medication for depression and anxiety, and I felt a sense of relief. And I remember seeing the diagnosis on the paper and in the chart of
Hmm.
postpartum depression, and that it just clicked for me. I was like, oh, like I felt a sense of relief because it had a name and someone
Right.
had a diagnosis. And so I'm
Right.
like, that's what's wrong with me. I'm not going crazy.
Right. Right. That's quite
Uh,
a relief.
it
Um,
was.
yeah. I wonder too if like, how you were saying what you had heard about postpartum depression was this other thing, and you knew that you didn't really feel that way. What it was like to then hear or realize that you were experiencing postpartum depression. Like, yes, the relief, but like based on what you had heard before, did that shade any of that relief?
It was just, I think, kind of confusing and muddled for me because I didn't
Hmm.
know. I'd never really had depression. Or anxiety. And
Hmm.
so seeing that diagnosis and going, okay, well, but this isn't what I've typically heard. So what
Yeah.
does it entail? So that just kind of prompted me to do a lot of research on my
Mm.
own.
Mhm.
And when I came across the websites and in the Instagram pages and stuff, and I started looking into it myself and going,
Mhm.
okay, well, I didn't realize that all of this was part of postpartum depression or postpartum anxiety. And so, once I started looking into it and the specifics of it, it made a lot more sense to me.
Yeah.
And working, with mostly males, I didn't screen for postpartum depression. I
Mm.
hadn't heard of that really much in my professional life. And then, you know, no one really talked to me about it before or well during pregnancy or anything after other than suicidal thoughts, thoughts of harming your child.
Mhm.
So those weren't on my list. And so I had kind of pushed it to the back of my mind. But
Right.
once I got diagnosed, I started researching and noticed, realizing, hey, this is a real thing and how common it is.
Yeah.
And realizing that, okay, this has happened to me. And
Mhm.
for a long time, I felt like less than as a mother, right? Because I'm like, well, I'm not a normal mom because I have this postpartum issue, this depression,
Mhm.
anxiety.
Mhm.
And it took me a long time to just figure out. Actually, it took me meeting a lot of other moms that dealt with the same thing
Oh, okay.
to
That
make that.
and those moms were talking about it and sharing?
Yes. And so the only way I reached out is we have a local area mom group. It
Mm,
has nothing to do with mental health. It's just all things mom. And I think I had reached out there just asking, hey, has, anyone struggled with postpartum depression?
mhm,
Um, and I had one person reach out to me and message me, and she said, "Hey, I'm a mental health advocate. I suffered with this with my son, and I'm
mm,
here to talk." And so, really, this one person reaching out and telling me, like, "Hey, this is a real thing. I suffered from it. I help other
mhm,
moms with it."
mhm, mhm.
Um, and then from there, I got connected with other moms. Um, and so, having to reach out on my own and find that person. And then after that, I just started talking to other people about it. I would bring up
Mm,
this when I had friends that were having children, I would ask them.
mm.
And that's what I realized is that people weren't asking me.
Yeah.
Um, Nobody asks you how you're doing after the baby as far as
Right.
your mental health.
Right.
Um, and so it all started to make sense, but it took months and months for me to figure this out. So I think I
Mhm,
went 10 or 12 weeks before I started medication.
mhm,
Uh, Probably, around the same time before I met someone, a little longer before I met someone that had dealt with it personally and who
mhm.
was like, hey, I'm here. And so, I felt really alone at first because it was just me and my
Yeah.
diagnosis.
Right.
I
Right.
had one, a supportive friend, and I didn't really tell anybody either. I wasn't talking to my family or my husband or a lot of my friends about it because I was almost shameful or embarrassed.
Mm.
I want to
Like they didn't know at all?
No, a lot of
Oh,
people didn't
uh-huh.
know.
Yeah, yeah.
Um, and I just had one really close friend and a coworker that I would kind of share with. And they were supportive and they would, be there for me. But a lot of people didn't know. And I didn't talk about it. And because for a long time I just thought, well, something's wrong with me.
Mhm.
These
Yeah.
other people, they have it so easy and their babies are easy and mine's really hard. And they seem happy and their marriage isn't being affected and mine is falling apart. And
Uh-huh.
all these areas of my life that I felt inadequate. And so I didn't want to admit that, or I didn't want to really talk about it. So, keeping my
Yeah.
circle very small of trying to figure out what was going on and who I could talk to.
Right.
Um, and so from there, once I finally met someone and once I got, on medication and started to get a little more clear headed, um, once my daughter's colic cleared up a little bit,
Mhm.
I remember her at, between 5 and 6 months as being like when I really got to start enjoying motherhood.
Mm,
Uh, I remember feeling happy then and enjoying it.
mm, mhm.
And I felt like prior to that, that my depression was kind of stealing all of those joyful moments because the
Yeah.
depression anxiety took over. So, I would say around 5 or 6 months is when things started to change a little bit.
Mhm.
Uh, my medication had kicked in, and my daughter's colic was getting better. And so I remember being able to enjoy motherhood a little bit more. She was giggling, she was reaching for her toes, those kinds of things. And I
Mm,
remember just being happier at that moment. I would say the crying spells got better, with that depression that I was going through of just having no energy and feeling down and crying all the time. It kind of got better.
mm,
Um, but then I was still having a lot of anxious thoughts, a lot of anxiety, a lot of,
mhm, mhm,
I guess, overly attachment to my baby.
mhm.
Uh, and I still had a lot of those intrusive thoughts that people don't talk about as well.
Right, right, right.
Um,
Those are really tough.
that is tough. and and I want to say I don't even remember when I started therapy, but
Mhm,
I decided I needed to start therapy. I had kind of gotten back and forth with a couple of doctors on medications, um, and
like
finally,
trying different medications?
yes. So it would
Oh,
work
okay.
for a while, a few
Uh-huh.
months or a year, and then, I would switch it up. And and she was probably maybe a year, and my primary care at that time was like, I really think you need to be referred to a psychiatrist. I think they need to manage the medications and really figure that out because that's their specialty. And being in the mental health field, it should have been fine, but I kind of had another freak out moment of,
Yeah.
no, I don't need to see a psychiatrist. Like,
Right, right.
I'm not crazy. I don't need that. And I had a breakdown with my friend who works in mental health, and she says,
Hmm.
it's going to be fine. And it was the best decision because he really understood what my symptoms with the current and the issues with the current medications. And when you're nursing, there's limited options as well. So,
Hmm. Hmm.
um, and then from there, he was like, I really think that you should get into therapy as well. And
Hmm.
and that was really, really life changing for the anxiety.
Oh, good.
Um, those intrusive thoughts and just that excessive worry and that those things that go on in your mind that you can't tell other people that you can't stop.
Yeah.
Therapy is such a good way, a healthy way to get that out, and try to decipher what's reality and
Mm,
what's your anxiety, what's your depression that's lying to
mm,
you,
mhm,
and
mhm.
what are some ways to change your way of thinking and combat those negative thoughts. And that's hard to do, even if you work in the mental health profession. It's hard
Yep,
to do on your own.
yep.
You can't do therapy for yourself. So
Uh-huh.
having that outsider perspective, she was a mom, she was a younger therapist with young children. She was a mom, trained in her therapy. It just really helped me connect with her, and she had great ideas that I would have never even thought of.
Mhm,
So
mhm,
something even as simple as I was on my depression medication. The baby was sleeping mostly through the night, after a year. And she was like, I said, I'm still just so tired. I'm so fatigued. And she said, are you sleeping? I said, well, yeah, and the baby wakes up to nurse, a couple times, but she said, well, do you wake up other times throughout the night? And I said, actually, I do because I have her monitor turned all the way up. It's right next to
mhm.
my bed. Anytime she makes a little noise, anytime she rolls over, anytime she does anything, I'm wide awake,
Yep.
even
High
if I'm not
alert. Yep,
in bed.
yep. Mhm.
And so she said, how many times are you waking up a night? And, 3 or 4. And I said, I don't know, probably 10 or 12.
Oof.
And she
Yeah.
said, that's why you're so tired because you're not really getting full sleep. You're not
Mm,
sleeping throughout the night. And that was part
mhm,
of my anxiety, right? I'm like, she's in the other room. I need to be able to hear.
mhm,
And just something as simple as her saying, let's try turning down the baby monitor to very, very low. She said, is your baby close enough in the house where if she wakes up and actually cries, you can hear her? And I said, oh, yeah,
mhm,
we had a small house at the time. I said, I can hear her clear across the house if she wakes up. She said, okay, so let's turn the monitor down
mm.
and see how that works. And just that suggestion, it was a simple suggestion that she came up with, but it helped me because I
Right.
realized, "Hey, I can actually sleep now."
That's awesome. It's a game changer too. Um,
Yes, it and that was.
mm,
So
yeah.
it was a journey of just finding different techniques,
Mm,
and the therapy helped, the medication helped, and
mhm,
then finding my group of moms. What I From my one friend I met online, she
mhm,
had a Facebook group, and she was like, "Hey, come visit our little postpartum Facebook group." And so I did. Got met a few other moms from there,
mhm.
and that really kind of started my brain thinking like, why do we not have anything? Why are there no services for moms? Why is there not support groups or anything available like this if people aren't talking about it? And so I
Yep.
decided I was just going to come up with a support group. I thought,
There you go.
I know it's needed. I'm a
Yep.
licensed social worker. Like, I know how to do groups, psychoeducational groups, support groups, peer groups, any of that.
Mhm.
Um, and so I started up one, and that's been going since 2017, I believe.
Oh, nice.
So
Yeah. Yep, yep. That's great.
yeah, so just the anxiety, the depression, the intrusive thoughts, all of these things
Mhm.
that nobody talks about. I started talking about that with people, and I started asking questions and asking moms and figuring out how they were doing, because that's what I needed. And so I wanted to
Right.
provide what I didn't have before.
Absolutely. Yeah, that's so, like as a facilitator of a group, were you, did you feel like that was helpful in hearing other people's stories too? Just to realize even more deeply your own experience?
Sure. And what I realize is that everybody coming through those doors, first off, getting to tell your story and having someone validate
Mhm.
that it was your story and yes, it's been hard, is
Right.
healing itself. It's therapeutic just to sit down with a group of
Mhm.
people who have been there and who understand. And
100%. Yep.
you can tell them your story and go, "This is what I experienced." And they go, "Gosh, that sounds like it's been really hard. I'm so glad that you're here. I'm so glad that you made it through." And that just means a lot.
It does, and it's like a relatively simple thing, but it's massive in terms of like how much we need that when we're
Mhm.
going through something like this. I mean, I resonate with your story in a lot of ways. I have had a kind of a similar trajectory, and that like hearing and seeing that it's a real thing is and that other people validate your experience. It's amazing how healing that is.
It is. It just knowing that you're not alone is so big in
Mm-hmm.
this thing
Mm-hmm.
called motherhood. So
Yep.
having other people that, I felt like I was less than, or I something was
Mm-hmm.
wrong with me,
Mm-hmm.
or I was broken because I had this issue, but I wasn't. And it's so common. And there's so many other moms that struggle with
Yeah.
the same. And so it made me feel normal, made me feel heard and
Mm-hmm.
seen. Um,
Mm-hmm.
and we did that for each other. And it is just really powerful.
Yeah. Yeah, it really is. You definitely need that for healing. And I think for a lot of people, like, sharing in a group setting or being in that, it's vulnerable. You feel vulnerable sharing this. You're not quite sure how people are gonna hear it or experience you, or all the things that that I think the shame part that you were talking about that you had felt earlier, when you were talking about like not wanting to tell people. It really takes a while to kind of come out of your shell and see if there's a safe space.
It does. I mean, you're afraid of judgment and you're
Hmm.
afraid, um, of feeling like a failure. There's just a lot of moms are afraid they're going to take my baby away if I tell them these
Hmm.
intrusive thoughts that I'm having.
Hmm.
There's a lot of reasons, that people don't share. Or you do feel very vulnerable, and when you feel like you're one of the only ones, it's scary. It's a scary place to be in.
For sure. Yeah, for sure. Yeah, and the more you were saying earlier, that like worry that people would see you as a or you'd see yourself as a bad mom or one of those moms who, whatever the stereotype is of postpartum depression and mothers, that worry is a real worry because some people don't understand it. A lot of people don't understand it. Like they don't know how to deal with it, I guess. You were saying before, like even within your family, there was a certain perception of what postpartum depression is. You don't want your family thinking those things about you.
Right, and even with a spouse, it's hard because he had no idea what was going on with
Right,
me.
right.
Didn't either for a while. But it was still there was just a huge disconnect of trying to have him understand what my struggle was and what's going on. And for some people to even believe that there is a such thing as postpartum depression.
Right, right. Ooh, did you come across that? People who just totally denied it?
Well, I think people were just more of, this is normal, it'll pass, let's baby
Mm,
blue, temporary, it's fine. Which I could understand in the early stages, but mine, it took a good 2 years to really get back to a healthy mental place for me.
mhm, mhm,
And after a lot of help from, a therapist and my doctor, my social group, all of that. And it took a real toll on my marriage too. I think my
mhm.
husband was clueless. He didn't have a clue what to do. You know, one
Right.
other one other symptom I had, my depression or anxiety, they both, can manifest as anger.
Mhm.
And I, a lot of times, was an angry person and very on edge, and that is the opposite of my personality.
Right, right.
Um, and so trying to figure that out as well. Why am I so angry or short tempered?
Mhm.
I've never had those issues before, and then you think that makes you a bad mom because you're frustrated.
Yeah. Yeah, absolutely. That's one of the harder ones to uh, for like people to understand and to know. How to understand your experience of it is really difficult for others, and like you are also having a hard time understanding your experience. Like, there are ways in which it, like you're saying, it's not like you, and it doesn't make sense necessarily that you, who are not an angry person, are all of a sudden feeling that. Did it get to a point of like that really intense ragey feeling?
It did. It did, and that was kind of in the middle of a medication transition for me,
Mm, mm,
uh, and it was a very, very scary event that just was like, "Whoa, okay, this is not me." And I remember being a little bit on edge sometimes, being like, "Why am I getting frustrated or angry with my baby who doesn't know any better?"
right, right.
But also, I say one of my biggest triggers was my husband, and for months, I thought it's just him. He's the problem.
Hmm. Yeah.
Um, and we had a big blow up one night when I was in kind of a medication transition, and I just exploded at him and like I've never done before. And I could have
Hmm.
sworn that if I had a knife in my hand, I almost would have stabbed him.
Hmm.
And it was just very out of character. And I thought, my gosh, I have never been like that upset or felt rage. And I
Hmm.
don't even remember what it was about.
Right, right.
But I just felt that loss of control of my emotions.
Hmm. Hmm.
And I remember just feeling like, okay, this is very scary. I've never felt this way before. I don't know what's
Hmm.
going on. The medication I was on at the time was it didn't work out to be very well, but
Hmm.
that was actually when I transitioned to see the psychiatrist because the primary
Oh,
care was like, okay,
uh-huh.
this this was a big, a big thing for you saying, hey, this is my red flag. This medication's not working. I'm this making my rage worse, my anger
Right.
worse. It went from irritability, and short tempered to just almost ragey. And
Hmm.
yeah, and that was just not me. And so yeah, that was my big clue of I need to change medications and get that under control. Um,
Yeah, yeah, that is scary. I mean, having that really intense feeling. It's hard to know what to do with it too, because as I have experienced it also, and what I hear from a lot of people is it's like a whole body thing. It's not just like you have a thought or something, your whole body is just like vibrating. Um,
yes, and I do remember having those a couple of times and just feeling like I said where I was out of lost control of my emotions.
mhm,
And it was anger, it was, it was rage, it was panic attack, it was just I remember driving feeling like that one time and I thought, okay, I shouldn't be driving like this because it's very dangerous to be
mhm,
in this state of mind. It was scary. It's very
mhm,
scary. And that's the kind of
mhm.
things you don't want to tell people about.
Absolutely. Yeah. Yeah, it is hard to talk about. And like when you're having that really intense anger feeling with these kind of intrusive thoughts coming along with it, like obviously you would never hurt your husband. And that is, but the feeling is as if you could.
Right.
It's hard in the moment to like reconcile that. Because then afterwards, after like that anger comes down, um, all like the shame spiral usually comes after.
Exactly. Because I felt so embarrassed. Like that is not me. I'm so sorry that I let my emotions get like that and I felt out of control. And I'm so sorry that yeah, it just wasn't me. And then you do feel shameful and you feel, embarrassed by that. And of course you don't want to tell anybody.
Yeah,
And I remember going to the psychiatrist for the first time and just crying and telling him, like, this is how I've been feeling. This is not me. I've got to do something about it.
right.
And he knew what to do right away, thankfully. So,
That's great. That's so good. That's so good. So you have this like really deep and painful internal experience, then it's having these like repercussions in your marriage, but at the same time you have the support of other people um, who maybe understand it, maybe don't, like fully, like why it's happening and all that. And it can feel, I imagine, or it could have felt really difficult to have a safe place somewhere else and to not like feel that at home. Not like it was unsafe, but just that like the intense feeling towards your husband.
Yeah, and I just thought, he was the issue. He was my trigger, and it
Mm-hmm.
really took probably a good 2 years to where when I finally got, very stable and just very healthy, and I could look back, I was like, wow, I think I was a lot of the issue, a lot of the
Mm-hmm.
issue for me and my internal struggle, and I feel bad for those 2 years of thinking that my husband was the problem.
Mm-hmm.
Um, but it was hard on us, and that was another thing that was felt shameful,
Mm-hmm.
like
Mm-hmm.
people with their babies and their marriages are flourishing and they're all in fantasy land over their new baby, and we're over here, in our house, all of us just trying to breathe. Like
Mm-hmm.
it's intense in this environment that we're in right now with a
Yeah.
colic baby and unstable wife and a husband who's clueless about what to
Mm-hmm.
do for either of us. It was just a really, really hard. It was a hard season for all of us. It really was.
Absolutely. Absolutely. So, and you kind of also alluded to like feeling and seeing that other people are having like are flourishing and not having any difficulties at all. So I assume that was outside of the group of women that you found to be close with. Where were you seeing all of this flourishing
So,
life?
it's mostly just what you see online. Um,
Hmm.
I've Facebook and Instagram and seeing all of these people that have their babies and they seem happy and their family seems happy and they seem to have it all together.
Hmm.
Um, which was, when you struggle, then you feel like even more of a failure or a
Hmm.
disappointment. You feel,
Hmm.
why does everybody have their life together and why does it look so easy from the outside? And some people like me are over here struggling. Uh, it's so
Right.
hard.
Hmm. Yeah. And I don't know about you, but when you're already feeling this like internal difficulty, and then you're going online, you're either like most often at home, maybe sometimes at work or whatever, but you're in the environment where you feel the most tense and most difficulty while you're looking online at people who are like seemingly having the time of their life.
Sure. And
Yeah.
that is really hard to, again, it makes you feel more like you're the only one in the whole world that is struggling with this, and why are you failing when everyone else seems to be having a great time? People do not post or comment or share things that are scary or
Hmm.
difficult.
Hmm.
People don't talk about it um, near enough, and so
Right.
what you read, is usually positive. And nobody's sharing these things, even though it's so, so common. And it took me a long time to figure out exactly how common it is to people
Mm-hmm.
with postpartum mood disorder.
Right. It's sort of shocking how common it is in contrast with how little support people get and how little people really know about it. I think in part to like what you're describing as your experiences is so internal for some time, and you have to get sort of the right providers or right friends or somebody who knows something about it to support you in the right direction.
Right. And yeah, and I even think just for months and months, it was still just, a very small circle of people that knew about it.
Hmm.
And then I slowly met other moms who were dealing with it and got to relate to them. And that was so healing, for me and for them to
Hmm.
realize that this is common. We're all struggling, and there's a lot of us that have the same experience. And that
Yeah.
talking about it helps, it helps everybody feel normal. It helps us to realize that we're still good moms and we
Hmm.
love our babies just as much as someone who doesn't have a postpartum mood disorder. Um,
Absolutely.
you know, um, our experience is different, but still, we're still worthy, and
Yeah.
we're still just as good of moms. So that was kind of a hard concept to get through. But then I love to helping other people realize that that
Hmm.
there's nothing wrong with you, and it's okay to have this, and it's very common, and um, that you're
Right.
still doing a great job.
Yeah, absolutely, 100%. Like, I couldn't agree with you more. Um, and, when you're in it, that doesn't feel true. But like you said before, when you look back on it, you can see all the ways in which you were a good mom. You can see all the ways in which you struggled too, but in the moment, it's really hard to feel that you're still a good mom. Um, yeah. So I mean, I love your message to parents, and I hear how passionate you are about making sure they understand that. And so you're doing that. You're doing that within your community. Can you say a little bit about, that group and I know it's been going for a bit, but yeah.
Yeah. So, I just had the idea that, hey, I want to start something in person. And I
Hmm.
actually reached out to another friend who was also a social worker in the community. And she had a child shortly after me. And we got to talking and figured out that we had both had the same struggle. And
Hmm.
I really want to do something. I want to provide something in the community. So her and I kind of teamed up with our resources. We found a facility and we just put it together. And I had told her, I don't care if I have to do it out of my house. Like, I'm going to have a group where women can come and we can talk about this. But we
Hmm.
found a place that let us use their facility for free for years, which is so nice.
Yeah.
Um, and we just kind of put the word out there on our Facebook pages and in our mom groups, for the local community. And so it ended up being, four of us that were two clinical social workers, and two that were mental health advocates and moms with similar experiences. And we formed this in person group. Um, and we do it every month. And for
That's
the
great.
first few months, it was just her and I, my friend and I, which was still beneficial because we would come and talk and
Yep.
share with each other. But once we started getting participants, it was just, it was great. And
Hmm.
it goes through phases because we get moms that have new babies and then the
Yep.
babies get older. And
Hmm.
so, every few months or every year or so, then we get a new group of moms. And it's just so fulfilling to just be that person in that moment to say, welcome, we're here for you. Um, and we try to just get word of mouth really through social media, and then we've got contacts at like the pediatrician's office and the
Hmm.
OB/GYN's office that will hang up our group flyers. And so we have
Nice.
people that come in and say, well, I saw your group flyer at my pediatrician's office, and so I decided to come check it out. And so we've had lots of moms in and out over the years. And it's been great. It's been really, really great just getting to share that with moms and help them
Hmm.
through that. And
Hmm.
I get to snuggle babies, and so that's one of my favorite parts of it.
For sure.
So we started that, and it's been going strong. Like I said, I think 2017 is when we started it
Yeah.
because daughter was not quite 2 yet. She was still
Hmm.
pretty young. And so we started that, and, some months we'll have one person show up, and some
Hmm.
months we'll have, 10 people show up.
Hmm.
And so we just provided that safe space. Given my background in social work, sometimes we're just doing mom to mom talk. Let's talk about life. How's it going?
Hmm.
Who's teething? Who's dealing with in-law issues? How's
Right.
work for that? But sometimes it's educational. And so I will pick a group topic, anything from, how to manage your anxiety, coping tools, setting boundaries with families,
Mm.
how postpartum can affect your marriage,
Yep.
um, dealing with depression and recognizing signs of that, giving resources for, therapists or medication providers in the community.
Hmm.
Just sharing information and knowledge and experience really is what it's all about, and just bringing moms together. And so that has been a really joyful thing in my life for the last few years.
That's great.
Reached a
That's
lot of others.
Yeah, I'm sure you have, and it is such a valuable resource, especially in the community where people feel it's close to them. They can come in person. They can, bring their babies, and of course, that's a benefit to you too. The
Oh,
baby
yes.
snuggles, the baby snuggles are
We
great.
we bring snacks, we always have chocolate,
Nice.
and
Yeah.
we say kids and babies are welcome, and
Hmm.
so there's no, barriers. If you need to bring your baby, if you need to nurse your baby during group,
Hmm.
if you need to bring your toddler and have them run around and let me hold your baby and you just take a break,
Hmm. Hmm.
supportive environment. It is good to meet other moms and to hug someone and, just say for you. And so it's been really positive. And we've helped a lot of moms, throughout the years, and I just love it.
That's fantastic. Well, thank you so much, Rosalinda, for coming on and sharing your story. And as I
Yeah,
said before, I can relate to some of the experience that you had. And I know that a lot of other people will and find healing in that as well. So thank you so
great.
much.
That's my hope. So thank you.
Thank you again, Rosalinda, for sharing your story. As you all know who have been listening to this podcast, we are dealing with a lot of similar symptoms and maybe similar diagnoses and life circumstances across, all of the stories we've been hearing. Some of the people who are coming on to share their stories are sharing a similar message, wanting you to know that you're not alone. Please share this as far and as wide as possible so that all new parents out there can understand what they're going through and feel heard and seen. Thank you so much for joining us. Until next time.